Peripheral neuropathy is any condition that affects the nerves outside the brain or spinal cord. It can be caused by a number of things, including trauma, infections, and genetic disorders. It also has many symptoms. Many of the causes, forms, or symptoms of this condition can be treated, but they can vary greatly from person to person. What are the symptoms of peripheral neuropathy? Peripheral neuropathy has many symptoms. The condition can affect a single nerve, a group of related nerves, or multiple nerves in different parts of the body. Symptoms depend on the type of nerve signal that is affected, and several types of signals can be involved. The symptom types include motor, sensory, and pain autonomic. 1. Motor symptoms. The peripheral nervous system transmits motor signals, which are commands sent from the brain to the muscles. These signals allow us to move. Muscles need nerve connections with the brain to stay healthy and work properly. Motor symptoms include muscle weakness and paralysis. Damage to the nerves from peripheral neuropathy weakens the muscles that are connected to them. This can cause numbness, difficulty moving your toes, foot drop, and weakness in your hands. Weakness can also affect the muscles in your thighs, arms, and other areas. Muscle wasting. When nerve connections are lost, muscles can shrink and become weak. This happens especially in the feet, lower legs, and hands with peripheral neuropathy. Sometimes, the loss of muscle mass causes the feet and hands to become misshapen. Uncontrolled muscle movements. Sometimes, nerves that have lost their connection to the brain due to peripheral neuropathy become overactive on their own, causing spasms. 2. Sensory symptoms. Peripheral nerves convert information about the outside world into nerve signals. These signals are then sent to the brain, where they are processed so that you can perceive the world around you. Peripheral neuropathy can interfere with what your senses pick up from the outside world or with your senses' ability to communicate with your brain. Sensory symptoms of peripheral neuropathy include tingling. This happens when there is a problem with the nerves that carry signals to your brain. This is like the radio blackout you hear when you are too far away from a station. Numbness. This happens when nerves can no longer send or transmit sensory signals, causing a loss of certain types of sensation. Examples include picking up a cold can of popsicles but not feeling the smoothness or coldness of the can, or not being able to feel the texture of the carpet or the temperature of the floor through your feet. Imbalance and clumsiness. Nerves also transmit sensations that your brain uses to track the position of your hands and feet. You may not be consciously aware of these sensations, but they are important for balance and coordination. Without them, you may lose your balance and be clumsy, especially in the dark. Pain. Damage to nerves from peripheral neuropathy can cause nerves to malfunction in how and when they send pain signals, making them stronger, hypersensitivity, or more likely to occur, allodynia. Nerves can even spontaneously generate pain signals. This is called neuropathic pain, and is the most noticeable and devastating symptom of peripheral neuropathy. 3. Autonomic symptoms. Your body has many autonomic processes. These are automatic functions of your body that occur without you even thinking about them or being aware of them. These include sweating, digestion, and blood pressure regulation. Autonomic nerve fibers transmit autonomic signals. Disruption of autonomic signals means that the body's automatic processes are not working properly. Some may work intermittently, while others may not work at all. Autonomic symptoms of peripheral neuropathy include blood pressure changes. Your body manages your blood pressure automatically, but peripheral nerve damage can interfere with this. This can cause your blood pressure to drop suddenly, especially when you stand up, or your heart rate to increase. Sweating too much or too little. Your body manages its internal temperature automatically by losing heat through sweat. Peripheral nerve damage can cause you to sweat too much or too little. This can cause dry, scaly feet or excessive sweating after meals. Bowel and bladder problems. Autonomic nerve signals control your bowels and bladder without you thinking about it. Nerve fiber disorders can affect bowel movements, constipation or diarrhea, and sometimes bladder control. Sexual dysfunction. The autonomic nervous system controls sexual arousal. This is why autonomic problems can cause sexual dysfunction. Who does peripheral neuropathy affect? Peripheral neuropathy can affect anyone, regardless of age, gender, race or ethnicity, personal circumstances, or medical history. However, some people are at greater risk for developing certain types of peripheral neuropathy, See causes and symptoms below for more information. Peripheral neuropathy is also very common in some age-related conditions. That means that your risk of developing peripheral neuropathy increases as you age. How common is it? Peripheral neuropathy is common, in part because the term covers so many conditions. Worldwide, about 2.4% of people have some form of peripheral neuropathy. Among people over age 45, that number increases to between 5% and 7%. How quickly does peripheral neuropathy develop? How peripheral neuropathy develops, and particularly the timeline of its progression, varies greatly depending on the cause. It can develop immediately following an injury or within minutes or hours. Some toxic and inflammatory peripheral neuropathy can develop rapidly over a period of days or weeks, while most other conditions take months, years, or decades to develop.